morning, everyone. Today, I have the honor of introducing Zara Ahsan, who worked with the Diversity, Equity, and Inclusion Anti-Racism Sickle Cell Disease Research Team under Dr. Judy Cavazos. And a fun fact about her is that the first professional sports game that she attended was a cricket match. And good luck, Zara.
Thank you so much for that introduction. Hi, I'm Zara, and I'm a rising junior at Skyline High School this year. This project is titled Association Between Hydroxyurea Use and Self-Reported Cognitive Functioning and Barriers to Hydroxyurea in Adults with Sickle Cell Disorders. In other words, we're looking at barriers to drug adherence in this population. This research was conducted by myself and my mentor, Dr. Judy Cavazos, Dr. Marcia Treadwell, and Dr. Wendy Santos Morissette. And I'd just like to give a quick shout out. This project would not be possible without you guys. Thank you for all of the looking over first drafts and advice and everything in between. I couldn't have done this without you. Sickle cell disease, or SCD, causes red blood cells to curve or sickle. Imagine a healthy red blood cell in the shape of an apple and a curved sickled cell in the shape of a banana. This blocks blood flow and oxygen flow throughout the body into the brain, leading to increased stroke risk and vaso-occlusive pain episodes, also known as VOEs. This has drastic neurocognitive implications, such as issues with memory and executive function. Hydroxyurea, or HU, is a gene-modifying therapy that reduces VOEs and hospitalizations. However, there are significant barriers to HU adherence, such as the aforementioned neurocognitive challenges and worry that patients approach it with, given its initial use as a chemotherapeutic agent. One thing I'd like to touch on is that in the United States, most people living with sickle cell are Black. Research on this disease is often limited due to the healthcare disparities in our system and the medical racism in our country. It is crucial that there is more time, energy, and resources dedicated to this disease. This study was conducted on data from the Sickle Cell Disease Implementation Consortium, or SCDIC, enrollment survey. We used data from 212 adults aged 18 to 45, looking at questions regarding HU adherence, neurocognitive challenges, and barriers to HU. Descriptive statistics, t-tests, chi-square analysis, and regression models were used to characterize and analyze our data. Here are some of the examples of the questions on our survey. Our first hypothesis going into this was that we would find an association between self-reports of worse cognitive function and lower adherence to taking HU. A secondary hypothesis was that worry or focus on possible negative side effects of HU was associated with lower adherence to medication. Oh, there we go. We found that neurocognitive challenges did have significant correlation to lower adherence. We also found that worry about HU, worse cognitive function, and older age were all associated with lower adherence. While worry was significantly associated with lower adherence, barriers we define as outside of worry were more significantly associated with lower adherence. We define worry as worry about ability to bear children and cancer risk. The demographic and clinical characteristics of our population are in the table below. One thing I'd like to highlight is that the majority of our participants, 53.7%, had an annual household income of $25,000 and under, characterizing them as low income in the United States. This is a significant piece of information in understanding the barriers our population has to care. Here's a closer look at our cognitive function T-score chart. Ensuring that individuals have the tools around them to be adherent and consistent with their medications is critical for optimal care. This research aims to contribute to improved quality of life and health outcomes. To our knowledge, this study is the first of its kind to examine the impact of self-reported neurocognitive challenges on medical adherence for this population. Future prospective research and qualitative data analysis is needed to better understand how to address the issues that this study brought to light. Here are some of my references. And again, I just like to give a big thank you to everyone on this list and the SSRP program directors and program for making this summer an unforgettable experience. Thank you.
Nicely done, Zara. Excellent. All right, who's got the first question? Like this project. All right, I'll start you off then. What do you think, or did you discuss how you could use this data clinically? So how could you use the self-reported neurocognitive function prospectively for helping patients to be more adherent to medication more broadly than just hydroxyurea?
This kind of feeds into my mentor's job, actually. She does neurocognitive testing and evaluation with sickle cell patients and is able to provide recommendations from there. So her job is like very active in the, kind of recommendations and help part with this. And I think this data brings to light a little more the neurocognitive challenges. She's also been working a lot on trying to provide systemic support to these patients, like developments of IEPs and basically more awareness around the neurocognitive challenges associated with this disease. And also, I think more research dedicated to this topic is truly very important because, as I said, it is under-researched, which I found during my lit review, I found that there wasn't a lot of data on this.
Excellent. Eric?
Yeah, first of all, amazing job. I loved your presentation. And my question for you is, I was wondering if you could discuss more about your future research plans on this project.
I won't personally be working with this project anymore, but I think qualitative data analysis would be something really important. Now that we have the numbers and the big statistics, I think it's important to go in and kind of see what the more like person-based responses are and individualized so that we can, analyze what we can do to address these issues, because this data kind of showed that they exist, but we need more focus on solutions or maybe ways that we can help with that.
Excellent. Yeah, that's a pretty impressive sample size to start off with. Nicely done. Yeah, there's some good data there. We'll look forward to talking with you more at your poster tomorrow about the detail.